the Doctor, featuring Southwest Florida's leading physicians, hosted by Dr. Gregory Leach and Jim York.
Good evening and welcome to Dialogue with the Doctor. We are here interviewing this evening a radiation oncologist, Dr. Chaundre Cross. He is with 21st Century Oncology. And as always, we will be talking about his profession, what he does, and specifically tonight, CyberKnife.
Dr. Cross, could you at least tell us a little bit about your background, where you're from,
Sure.
where your medical training is from?
Yes, I went to undergraduate at Northwestern University in Evanston, Illinois, and I did my medical school training at University of Texas, Southwestern in Dallas, Texas, and then I went on to Harvard Medical School at the Dana-Farber Cancer Institute and Brigham Women's Hospital, and that's where I did my radiation oncology training. From there, I left Boston in 2004, and I've been practicing here in Naples, Florida for 8 years.
And your name of your practice and where you're located?
Yeah, 21st Century Oncology. I have 5 different locations. One is on Goodlett Frank, and another is the Luckert Cancer Center, which is across the street from the NCH Healthcare System on 4th Avenue.
So University of Texas was medical school?
That's right.
And then at Harvard, that was residency in
right.
radiation oncology?
That's exactly right.
What did you specialize in anything at that time?
Yes, I was. My Harvard professors are well known for prostate cancer. I was going to stay on board, stay in academics. When I was a senior, I was a chief resident, and they had offered me to stay and do research in prostate cancer and to treat along with my Harvard professor, Anthony D'Amico, to stay on board at Harvard. At that time, I had a very difficult decision. I came down to Naples, Florida to interview. The CEO of my company, Dr. Danny Dostretz, promised me he would give me any tool I wanted to treat prostate cancer, as well as there's quite a number of prostate cancer cases here in Naples that rivals that of Harvard. And so it was a tough decision, but because we're able to provide the best technology here down in Naples, Florida, I chose to come to Naples, Florida.
Very good.
And maybe you want to start and go into the CyberKnife? That's what we're going to talk about this evening?
Yeah. And in Boston, we had a homegrown system that we called radiosurgery. So when we give conventional radiation therapy treatments, that's usually a treatment that takes a number of fractions, usually on the order of 5 to 9 weeks of treatment in order to deliver a high dose of radiation therapy. Now, conventional radiation therapy, where it takes these number of treatments, can take a toll on patients, as well as it includes a lot of normal tissue structures that can have a lot of toxicity for the patient. Let's say, for instance, for lung cancer. We usually treat with 7 weeks of radiation treatment, and that's 35 treatments, and each treatment takes about 10 minutes. Now, with that treatment, we can hit some normal tissues that can cause some side effects, such as the esophagus, the lung. All these things can cause toxicity to the patient. Well, in Boston, we endeavored on a project of radiosurgery, and that is where we can deliver that 5 weeks to 9 weeks of radiation treatment in 1 fraction of treatment, or in 3 fractions, or 5 fractions. Instead of the patient coming to the office 35 to 45 times, we can deliver the treatment in one treatment in 1 setting, or in 3 treatments, or in 5 treatments. And I learned my radiosurgery up there in Boston, and I took that knowledge down here to Naples. Now, there are different radiosurgery types of machine. One is called a gamma knife, and gamma knives are offered all over the country. But a newer technology is the CyberKnife machine. And what the CyberKnife is, it's an actual robot. It's a robotic radiation delivery machine. And it can deliver radiation in a single fraction to a brain tumor. or to a lung cancer. While other patients who may not have this technology available to them, they would have to go to the radiation facility 35 times. The beauty of the CyberKnife machine is that it's called CyberKnife, so it's like a phantom knife. It was originally used in the 1990s for brain tumors, and it replaced what a neurosurgeon could do by just using the cyber phantom knife. So instead of the surgeon going in and cutting open the brain and taking out a brain tumor, what the CyberKnife can do is no blood loss, no cutting, but it can shoot radiation directly to the brain tumor and leave all the normal tissue structures out of the way. Now, how does it do this, and how does a robot know how to perform this? Well, this is the first image-guided radiation machine available pretty much worldwide. And what I mean by image guidance is that before it delivers the radiation treatment to the area that it's going to, it images the actual tumor, so that it makes sure that when it's shooting the beams to the brain tumor, that it's directed just to the brain tumor. It has sub-millimeter accuracy. That is unheard of. Sub-millimeter accuracy means lesser toxicity, faster recovery time, and the best part about it is cure. And it can cure things in the brain quite easily. So we use it a lot for the brain. After the 1990s and the early 2000s, we started thinking, well, if we used it in the brain, why can't we use it in other places in the body? And so the first area that we started using it at was in the lung. And the lung, which usually, as I said before, takes 7 weeks of treatment 35 times. Well, with the CyberKnife, we were able to treat with just 3 treatments, 3 fractions of radiotherapy to the lung cancer. Patients would have the radiation for 3 days in a row. They would go home, and guess what? They didn't need a lobectomy. They did not need to go to have their lung removed. They had their lung cancer treated non-surgically, without blood loss, and with over 90% of efficacy. They had their lung cancer treated and cured. And we've been using it since the early 2000s for lung cancer with great success, and Naples is one of the pioneers of CyberKnife in the whole country. Stanford was the first one to start using it, and Naples on this coast was the first. And we were one of the first places in Florida to have a CyberKnife machine. So now we can treat bone disease, we treat the spinal cord, we treat the pancreas. We can pretty much treat it anywhere in the body. The one thing that patients tell me that they absolutely love about it is that instead of them spending time in a radiation facility, they can spend time doing their normal daily activities, such as golfing, playing tennis, working. It's so much nicer to be able to finish your treatments in that 1 week rather than going back and forth for 9 weeks of therapy. Because we're known for the CyberKnife, we have patients come all over the world to get their CyberKnife treatment. They spend the week in a hotel. They'll get their treatment in just 1 week, and they'll go back over to France. They'll go back over to Germany. Recently had a guy from Texas fly his private airplane over for his treatment. So it allows patients to actually get their treatments here and then go back home. And they go back to their doctors and they say, what happened? Your cancer's already treated? And they go, yeah, just went down there for 1 week. My cancer's already been treated. So that's what Naples is known for, CyberKnife machine. And I'll get into about prostate cancer specifically with the CyberKnife machine a little bit later.
I want to ask a question. You talked about the Gamma Knife first, and then the CyberKnife is the latest. What is the difference between the Gamma Knife and the CyberKnife?
Yeah, so the Gamma Knife is it's been out and available longer than the CyberKnife. And what it is, it's actual a radiation isotope that's encased in a shell. It's used, however, only for CNS disease, so for brain tumors. It's only used for brain tumors or arterial venous malformations, trigeminal neuralgias, but things of the brain. The reason why is because the shell that is around the head has little holes, and these holes open up for the radiation beam to come out. Therefore, it's limited. It can only treat things of the brain. It can't treat the lung, can't treat the prostate, it can't treat bones and other things outside of it. It's only meant to treat the brain. So it's a limited radiosurgery machine. While the CyberKnife is able to treat anything I want to treat that I can image, I can treat it head to toe.
So image, can you tell our viewers what you mean by imaging it?
Yeah, imaging is in the room. The robot is in the room, and there's a couch that the patient lays on. The couch has 5 degrees of rotational freedom. It can move all around, as well as the robot can move around the couch. On the ceiling, orthogonal radiographs are taken, and it's taken, and you can prescribe how often you'd like these orthogonal radiographs to be taken.
X-rays?
X-rays, and it's just simple X-rays that are taken every 15, 30 seconds, and it will image the area of where we want the treatments to go.
Okay. So accurately, you mean?
Yes, and so the imaging helps to guide the radiation therapy, but it also looks for any kind of movement of the patient while they're on the table. So as you can imagine, if you're sub-millimeter accuracy, we want to verify that the patient hasn't moved or hasn't moved their head. Now, usually for a brain tumor, they have a mask made so that they cannot move their head, but there can always be incremental movements I want to account for before the patient gets that therapy. So I keep on saying brain tumors. I often treat non-cancer. And one of the biggest things, like a lady I just treated yesterday, was trigeminal neuralgia. And that is a facial pain caused by a nerve that's hyperexcited inside of the brain. I'm able to treat that nerve to a big whopping dose of radiation in a single fraction with the CyberKnife. And that's not a cancer diagnosis. I can treat arterial venous malformations, which is just a conglomeration of these veins and arteries that can bleed easily into the brain. I can treat that precisely with the CyberKnife machine. I also treat meningiomas, or something else that we call acoustic neuromas. Acoustic neuromas can cause hearing loss. If I treat it with the CyberKnife before they get the hearing loss, I can save their hearing. So there's different indications for the CyberKnife that it's not limited to just cancer.
So even though we call you radiation oncologist, I'm not sure what we should call you guys anymore.
Well, one doctor in town calls us radiation therapists because we don't just, it's just not cancer that we treat, and so it's quite versatile. The ability when you have, especially a robot that's controlled by a computer. You may have heard like a Da Vinci robot for prostatectomies. It's a little bit different having the robot for the for radiation purposes.
Are there different, rates of cures on different subjects of, like brain tumor using a CyberKnife versus lung cancer, success rates?
Absolutely, and it all depends on the type of cancer that you're treating.
Right.
So there can be definitely a higher grade brain tumor and a lower grade brain tumor, and that's dependent upon what type of cancer that you're treating. When we treat and you look at surgery versus the CyberKnife machine, equivalent. There's no difference in outcome.
Okay.
When you treat like lung cancer, between CyberKnife and treating it with surgery with a lobectomy, there's no difference in treatment. So if you have someone who's elderly and they have poor lung function and they're not a surgical candidate, then CyberKnife would be perfect for them.
We can go to break.
Okay, well, we'll take a short break, and we'll come back in just a minute, and we'll talk more about with Dr. Cross about radiation oncology and more, the CyberKnife specifically.
I had been a practicing orthopedic surgeon for a number of years, and I thought that I was invincible to the multitude of medical problems I saw around me every day. Was quite shocked when I received a phone call telling me that I had cancer of the prostate.
Dr. David Spellberg of Naples Urology Associates is the local specialist in treating prostate cancer with the new CyberKnife radiation treatment.
Once I got myself together was to do as much research as I could, and what I was looking for was a treatment that would give me the least risk of complications and side effects. And that's where the CyberKnife came into the picture.
Advanced CyberKnife technology, precise. It sends just the right dose of radiation to the cancerous areas. Fast. Each treatment is only 1 hour, non-invasive. This outpatient procedure has almost no side effects.
The day after my treatment, I was out playing golf, and I'm looking forward now to continuing to enjoy a long and happy and comfortable life thanks to the care of my team of doctors and to the CyberKnife procedure.
Learn more about CyberKnife and Dr. Spellberg. Call today.
Welcome back to Dialogue with the Doctor. Once again, we're here with Dr. Cross. He's a radiation oncologist with 21st Century Oncology, and we're talking about the CyberKnife. And I think now we're going to go on to talk about a specific use for the CyberKnife.
Yeah, well, CyberKnife is a stereotactic radiosurgery device where we can precisely use radiation therapy to treat pretty much any cancer from head to toe. Naples has been known nationwide as well as worldwide for its treatment of prostate cancer. Prostate cancer is a disease that affects men. Usually we catch these early because of PSA screening. The PSA screening has allowed us to catch them so early that treatment and decision about what to do about the prostate cancer becomes a lengthy conversation with your patient. And the reason why is because we can recommend observation, we can recommend surgery, or we can recommend radiation therapy. Now, when a patient is decided upon treatment, they're mostly deciding between radiation and surgery. Surgery is usually nowadays done by a robotic called a Da Vinci system that robotically removes the prostate gland. It does require cutting. It does require you to be in the hospital. There is a recovery period of time. And so when a patient decides between radiation and surgery, they're deciding about side effects because the efficacy between radiation and surgery is equivalent. There's no difference, and it can be pretty stressful on the patient to decide on what type of treatment to do. Normally, when a patient decides for radiation therapy, that's a 9-week treatment. That's 45 treatments. They get treatments 45 times. Each treatment takes about 10 minutes. The actual beam is only on for 60 seconds, and it's delivered precisely to the prostate gland. It's a low dose, though, each day, and your body remembers each dose of radiation that's delivered every single day. And as you can imagine, 45 treatments, that's a lot of time. That's 45 days that a gentleman has to open up in the schedule to be treated every day, and it can interrupt their daily living, and especially those guys that like to play golf or play tennis. They got to put that in their schedule, and they have to finish up their 9 holes or their 18 holes and get to the radiation center or try to get treated before then. What Naples started in 2004 with Dr. David Spellberg is CyberKnife treatment for prostate cancer. This was done, the other place was Stanford University. Naples, Florida is known to be the leader in the number of patients treated with CyberKnife for prostate cancer early stage. We have gentlemen come over from all over the world and all over the country. They come and fly in to get the CyberKnife treatment. What CyberKnife is able to do is treat the prostate cancer. Instead of coming in 45 times for 9 weeks, it treats the prostate in 5 days. The patient comes in, lies down on the table, and the robot has about over 200 little beamlets, and they're very, very low dose beamlets. But what happens is that all these little beamlets are entering the body at all different angles, And the individual beamlet doesn't hurt, wouldn't even hurt a fly, but it converges all to the prostate gland. All 200 to 250 beamlets all converge at the prostate gland to give the high dose of radiation therapy. That means that the rectum, the bladder that's nearby, doesn't see that high dose. And it's an effective way to get the prescription dose of a high dose of radiation daily to the prostate gland without hurting and causing toxicity to the patient. So once the patient finishes the treatment, on that last day, the 5th day, they may have some urinary frequency, urinary irritation for about 2 weeks, 3 weeks, but they're back to their baseline at 4 weeks. The success rate of the CyberKnife for early stage prostate cancer has been greater than 96%. We have publication from Stanford, and they use the patients from Naples in the publication. So we are not only leaders in the treatment, but we're the leaders in the literature on the CyberKnife for the prostate gland, showing that this is equivalent to the protracted 45 days of treatment for prostate.
When you say early stage, what's early stage mean?
Early stage is clinical stage 1 and 2.
1 and 2.
And we stage cancer 1 through 4. 1 and 2 means that the cancer is confined to the prostate gland. There's not a large burden of disease within the prostate gland. The PSA is less than 10. And by far, that's the majority of prostate cancers being diagnosed these days because of the PSA screening. Most patients will have their PSA checked every 3 months after they've completed the CyberKnife treatment. And you'll see that by 1 year after they completed the CyberKnife treatment, their PSA should be underneath 1.0. We've had a great success. We've treated over 300 patients in the last 3 years. Since we started in 2004, there's been over 500 patients treated in Naples, and that's why we're in the world with that therapy.
When you say 96% success rate, you're talking about early stage 1 and 2, PSA
Yep.
less than 10. 90% success is defined as what? No recurrence for a while? Or
Right,
for how
over
long?
5 years.
5 years?
Over 5 years. We're waiting for longer term data, such as
Mm-hmm.
15-year data. We're at 2004 now to 2012. There was a change in the criteria of who we let onto the study in 2008 because we had we restricted the Gleason score, which was the grading system of the prostate cancer, onto the study. And since 2008, we've had 0 failures.
So you changed the type of Gleason score that you would take?
Right. So
Some of the higher level Gleason scores?
that's right. We don't take any 8s, 9s, or 10s.
Okay.
And so we grade prostate cancer 1 through 10. 8, 9, and 10 is considered high grade, and then the 7s, 6s, and the 5s we let on the study.
It's pretty impressive.
Yep, it's very, and if you go online, that's where you'll see how impressive it is, because the men who are treated by it, they swear by the treatment. There's no question, there's no other treatment for prostate cancer that has lesser amount of side effects. Surgery has its own side effects and profile, and I'm sure that you can go and ask a surgeon about all those. But in terms of the least amount of side effect, the least amount of time for treatment, CyberKnife has done a great job for early stage prostate cancer.
And we have that here in Naples.
And we had it here in Naples, and you have the most experienced team with Dr. Spellberg at the lead, nationwide and worldwide, right here in Naples, Florida.
So you can fly in, stay at a hotel, play golf, and get your radiation
That's
therapy.
exactly right. That's exactly right, and it happens all the time.
That's pretty amazing.
The people who come from Europe, they usually have someone here that they know, and recently it was a brother, and I treated his other brother. And he's like, come over here and get this treatment.
Do they not have that technology in Europe, or
So-
is it limited, or what?
So the radiation machines are available worldwide, nationwide. It's all about when you go in to have your esophagus taken out, when you go in to have your pancreas taken out, you're going to go to the people who have the most experience. You're going to go to the people who have been doing it for the longest. And we've been doing it the longest, and we've been doing it most successful. And we have our physics team has been here since 2004, since the inception. And then that's the key, is having the best physics team. And then you have your physicians and nursing staff that's used to any kind of side effect or anything that's abnormal. I mean, there's just a lot that needs to be taken in. And
tell our viewers what you mean by the physics team.
yeah, the physics team, you know, behind the physician, we're the guys who meet the patient. We're the ones who get them sign up. But the people who are behind the scenes, those are the people who are going to be rendering the plan. They're going to be quality assurancing the plan, and that is a PhD medical physicist, dosimetry, and then we have therapists. And that matters when you're getting treated for something like this, where we're giving such a high dose of radiation to a confined area. You want to make sure that the team that's in place has done this over and over and over again, because there are nuances, there are things that can happen, and it takes an experienced team to recognize it, number one, and then number two, how to deal with it. So we have an exceptional physics team and therapy.
Do you also treat higher stage or graded prostate tumors?
Yeah, we treat them, but we do that with more conventional, because this is a study, and we want the best outcomes from it. So right now, those patients would be led on to the study after we complete our 5-year from 2008.
So the stage, let's just say the stage, 3 and 4, do you combine surgery and radiation?
No, we usually do hormone therapy and radiation therapy for those patients.
Okay, no surgery.
And not surgery for those. So surgery is really in competition with the early stage prostate cancers.
So surgery is really kind of going out.
It is. I mean, we still, you still see it being done here in town, but by far, majority of patients are treated by radiation therapy, because the side effect profile is so much better.
And the success rate.
And the success rate's equivalent. So why put yourself at risk?
What are briefly, what are the most common side effects when you treat a patient?
Yeah, it's usually urinary frequency, urinary irritation, and then maybe a little bit of tiredness. Those are the three. Other than that, they're back to their baseline after therapy.
Nothing major.
Nothing major.
We really appreciate you coming this evening.
No, not a problem.
You've taught us a lot about radiation therapy, radiation oncology, and radiation for non-oncology.
Yeah, that's right.
And the CyberKnife. So
all right, thank you.
We hope to have you back.
Thank you very much. Thank you.
Cool.